Osteoarthritis, or OA, is one of the most common joint diseases worldwide, causing pain, disability, and a significant reduction in quality of life. Traditionally, OA was seen as a result of mechanical wear and tear, but recent research has shifted this perspective. Scientists now recognize that OA is shaped by a complex interplay of genetic, environmental, and metabolic factors. Among these, the gut microbiome has emerged as a key player. Gut microbiome refers to the trillions of microorganisms living in our digestive tract. Each person's composition is unique as a fingerprint. Changes in this ecosystem, known as dysbiosis, can influence inflammation and immune responses throughout the body, including the joints. This new understanding opens up exciting possibilities for both the prevention and treatment of OA, moving beyond the joint itself to consider the whole body. Gut-joint axis describes how the gut microbiome communicates with joint tissues through metabolic, immune, and hormonal pathways. Under healthy conditions, beneficial gut bacteria help maintain the intestinal barrier, produce anti-inflammatory compounds like short-chain fatty acids (SCFAs), and support immune balance. But when dysbiosis occurs due to factors like diet, aging, or antibiotics, the gut barrier weakens. Harmful bacterial products, such as lipopolysaccharide (LPS), can leak into the bloodstream, triggering immune cells in the joints and promoting inflammation. This process activates destructive enzymes and cytokines that damage cartilage and bone. On the flip side, healthy gut metabolites like SCFAs and certain bile acids can protect joints by reducing inflammation and supporting tissue repair. This intricate communication means that what happens in your gut can directly impact joint health, making the gut-joint axis a promising target for new OA therapies. Immune system acts as a bridge between gut health and joint disease. In a balanced state, gut microbes help regulate immune cells, preventing excessive inflammation. However, when the gut barrier is compromised, bacterial fragments and toxins enter the bloodstream, activating immune cells in the joints. This leads to the release of inflammatory molecules and enzymes that degrade cartilage. Studies show that people with OA have a different gut microbiome compared to healthy individuals, with fewer beneficial bacteria and more pro-inflammatory species. Certain bacteria like Faecalibacterium and Bifidobacterium are often reduced in OA, while others, such as Streptococcus and Enterobacteriaceae, are increased and linked to more pain and inflammation. Animal experiments confirm that altering the gut microbiome can worsen or improve OA symptoms, highlighting the importance of immune microbiome interactions in disease progression. With the gut-joint axis in focus, researchers are exploring new ways to manage OA by targeting the microbiome. Dietary changes, such as adopting a Mediterranean-style diet rich in fiber and healthy fats, have been shown to increase beneficial gut bacteria and reduce inflammation. Clinical trials suggest that probiotics, live beneficial bacteria, can help ease pain and improve joint function in some OA patients. The results vary depending on the strains used and individual patient factors. Prebiotics, which feed good bacteria, and even fecal microbiome transplantation are being studied as potential therapies. However, most evidence comes from animal studies or short-term human trials, and responses can be highly individual. Future research aims to personalize these interventions, identify which patients will benefit most, and ensure long-term safety. As our understanding grows, microbiome-based strategies may become an important part of OA treatment. While the connection between the gut microbiome and osteoarthritis is compelling, many questions remain. Most human studies are observational, and translating findings from animal models to people is challenging. There is significant variability in how individuals respond to microbiome-targeted therapies, influenced by genetics, metabolism, medications, and more. Standardized clinical trials with long-term follow-up are needed to confirm the safety and effectiveness of these new approaches. Researchers are also working to identify biomarkers that can predict who will benefit from specific interventions. Ultimately, a deeper understanding of the gut-joint axis could revolutionize OA care, offering more personalized and holistic treatment options. By integrating microbiome science into clinical practice, we may unlock new ways to protect joint health and improve quality of life for millions living with osteoarthritis.